Your Medicare costs are going up in 2026, and I'm not just talking about a few bucks here and there. Your Part B premiums, deductibles, and even drug plan costs are all going up. I see people every day who made the wrong choice years ago and now they're stuck. Like my client who's been trying to switch plans for a couple years now, but because of pre-existing conditions, we can't find her a Medigap plan she can afford. Don't let that happen to you. First, let's talk about the elephant in the room. Your Medicare Part B premium is jumping up from $185 per month to $206.50 a month in 2026, which means you're paying $258 more next year just for your basic Medicare. And that's before we're even talking about your deductible going up too. Now, if you're thinking, well, everything's going up these days, you're not wrong, but here's the thing. If you're just sitting there with plain Medicare and nothing else, you're going to really feel every penny of these increases right in your wallet. So this is exactly why we need to talk about your two main options, Medicare Advantage and Medigap plans. And this choice is bigger than just next year. It could affect you for the rest of your life. So here's the deal with Medicare Advantage. Instead of having your regular Medicare, you're getting everything bundled up in one package from a private insurance company. Your hospital coverage, doctor visits, and usually your prescription drugs too, all rolled into one plan. Now, most Medicare Advantage plans come in two main flavors, HMO and PPO, and understanding the difference is crucial because it affects how you get your health care. With HMO plans, you've got stricter rules, but the plans are usually cheaper. You need a primary care doctor and you need referrals to see specialists. So think of your primary doctor as the gatekeeper. If you want to see a cardiologist or a podiatrist, you usually can't just go directly to them. You have to go through your primary doctor first and get a referral. PPO plans give you more flexibility. You can see specialists without referrals and sometimes even go out of network for a higher cost. But here's what's happening. Many insurance companies in 2026 are dropping their PPO options entirely. So even if you want that flexibility, it might not be available in your area. Now let's talk about why so many people choose Medicare Advantage. I had a client who was going to have to pay over $458 a month between his Medigap plan, Part D drug coverage, dental insurance, and his Part B premium. When he chose to go with Medicare Advantage, his total monthly cost was just his Part B premium. That's over $273 a month back in his pocket. And for someone living on Social Security and a very small pension, that's huge. He can still afford his groceries without stress or without having to go back to work. Now, when he needed to see a heart specialist later that year, he did have to work within the plan system, getting a referral from his primary doctor first. He needed to make sure that the specialist was in network. The process took a little longer than just calling any specialist directly, but his out-of-pocket cost for the whole thing was only $35. So for him, the extra steps were worth it to save $273 a month. He even told me, I'd rather make a few phone calls and work with the network so I can save enough money to take my grandkids to Disney World. But I will say this, there's some good news for 2026. The government is finally cracking down on some of these insurance companies. They can't just keep changing their minds willy-nilly after they've already said yes to your hospital stay. And something I really, really want to remind all of you of is when people fight these denials, 80% of the time they win. That tells you something. These companies deny you because they know people won't appeal. Only 11% of denied prior authorization requests were appealed to Medicare Advantage companies in 2023. Now, these plans do throw in some extras like dental and vision, maybe a gym membership, sometimes even money back on your Medicare Part B premium. My client Joyce, she loves her plan because they give her money every 3 months for stuff from the pharmacy, and for her that makes sense. Now, Medigap, on the other hand, is completely different. Medigap, which are also Medicare supplement plans, is like gap coverage. It fills in all the holes that regular Medicare leaves behind. All those deductibles and copays that Medicare doesn't cover, Medigap takes care of them. But before we dive into how Medigap works, let's explain something that confuses a lot of people. There are actually 10 different Medigap plans labeled A through N, but most agents only talk about Plan G and Plan N. And there's a good reason for that. Plan F used to be the gold standard. It covered absolutely everything, including your Part B deductible. Most seniors loved it because you literally paid nothing out of pocket. But if you became eligible for Medicare after January 1st of 2020, you can't get Plan F anymore, and the same goes for Plan C. The government basically said, hey, these plans were a little too good, and we're just causing people to overuse medical services, so you can't sign up for them. Now, there are other plans, A, B, D, K, L, and M, but honestly, they either don't provide enough coverage or the savings just aren't worth the gaps that they leave for people that I work with. That's why most people tend to stick with Plan G or N. And the beautiful thing about Medigap plans is freedom. Remember my client with the referral hassles? With Medigap, if his doctor says he needs to go see a heart specialist, he just goes, there's no referrals, there's no networks, no fighting with the insurance company. If the doctor takes Medicare, you can see them, period. But Medigap plans cost more every month than Medicare Advantage. The premium costs vary by where you live, how old you are, your gender, and your health status. But Medigap Plan G in my area ranges from $121 to $386 per month for a woman just turning 65 and that doesn't use tobacco. But Medigap doesn't cover prescriptions at all. So you'll need a separate Part D drug plan. And if you don't sign up for Part D when you're first eligible, you'll pay a penalty for the rest of your life. That penalty is 1% of the national base premium for every month that you're late, and it never goes away. So when we're talking real numbers, you're looking at $300 to $500 a month total when you add everything up. Your Part B premium, which will be $206.50. Your Medigap plan, whatever number that is, and your Part D drug plan is a range, but usually like $30 to $80. That's your real monthly cost per complete coverage. But let's say you need knee surgery this year. You know what you'd pay out of pocket with Supplement Plan G? Nothing after your Part B deductible, which in 2026 is projected to be $288. And when you turn 65, you get exactly 6 months to sign up for one of these Medigap plans without any questions about your health. They can't turn you down. They can't charge you extra because you have diabetes or high blood pressure or whatever. But if you choose Medicare Advantage first and then want to switch to Medigap later, now they're going to ask you everything. How's your health? Any medications? Been to the doctor lately? Let me tell you about my client. Healthy as a horse at 65, chose Medicare Advantage because it was the less expensive option. We did discuss Medigap options and they knew the risks of not going with Medigap during that guaranteed issue period. But a few years later, she's diagnosed with a chronic condition and decided she wanted the freedom to see any doctor. When she tried to get a Medigap plan, they wanted to charge her $400 a month instead of the $145 she was quoted at age 65. $400. She couldn't afford it, so she's stuck. Don't let them talk you into thinking you can just switch later. Yes, there are a few states trying to change this. Minnesota might let people switch once a year starting in 2026, but most places you only get one shot, or if there's a special opportunity later. So how do you decide? This really comes down to your money situation first, and then your health needs. If you're living on Social Security and every dollar counts, Medicare Advantage might be your only realistic option. There's no shame in that. You need to keep a roof over your head and food on the table. Just go in with your eyes wide open about the trade-offs. If you can afford $200, $300 more a month for the freedom and predictability that comes with Medigap, and that won't stress out your budget, then you have a choice to make. Are you someone who's at the doctor all the time? Do you have ongoing health issues? If you can afford it, then that predictable coverage with Medigap actually might save you money in the long run, even though it has the higher monthly costs. Are you generally pretty healthy and comfortable following some rules to save money? Medicare Advantage could really work well for you. Just make sure you understand what those rules are going into Medicare Advantage plans. Do you travel? Do you have doctors you absolutely love and don't want to lose? Do you hate dealing with insurance company red tape? Then Medigap is probably your answer. So here's my honest advice. Don't just think about next year. Think about 5 years from now, 10 years from now. What happens if your health changes? Do you want to be able to walk into any doctor's office in America who takes Medicare? Or are you okay with staying in a network? Please, please don't try to figure this out by yourself. I see too many people make decisions based on a flyer in the mail or an ad they saw online or what their neighbor told them to do. Your neighbor's situation isn't your situation. I'm Callie, a licensed insurance broker and certified Medicare expert who's helped people across the country navigate these exact decisions. If you're feeling overwhelmed by all of this, and honestly, very understandable if you are, because Medicare is complicated, I want you to call me or schedule an appointment. This isn't something you should figure out alone. I'll sit down with you, I'll look at your specific situation, your health needs, your budget, and what's available in your area, and help you make the most informed decision that's right for your unique situation. Also, drop a comment down below with any questions you have about Medicare Advantage or Medigap plans. I read every single comment and I'll answer them in future videos. And if you found this video helpful, be sure to like the video and subscribe to the channel. And after that, click right over here to check out my next video with more expert Medicare tips like this. Thanks so much for watching, and I'll see y'all in the next video.